So being a general internist, I cared for some patients over 30 years. And really, that was a great privilege. So whole array of people there. Fellow that was there on D-Day. And so this guy, clearly, as he relayed the stories, that was emblazoned on his mind. Walking down the docks with all of the soldiers loaded in the landing craft, sending them across the channel, and then the harbor being totally empty, and then the landing craft coming back filled with body parts, and having to sort through and find letters and identification and all of this stuff. Really got to know him very well, followed him for years. Clearly this scarred him for life, obviously. And then others that went through Vietnam and talking about the carnage that they saw. And these are stories that none of their family even knew. That's one of the privileges of following these patients for a long period of time. When I talked at graduation, I just gave a couple of stories like one patient, bad sarcoid, so I was going through the complications. And he stopped me because I said, there's a 5% chance of this, a 3% of this, a 7, whatever. He said, no. It's 0 or 1. For me, I get it, I don't. I get the complication, I don't. I live, I die. It's 0 or 1. And that was really, that was a very powerful lesson to me. And another one, so this fellow, very successful businessman, had always been very involved in his medical care, got a very aggressive cancer, and I was going through what were treatment options. Again, what are the chances? And he said, no. I'm not going to beat this. We both know that. You tell me what to do. I'm too busy dying. And then we just flipped so that, okay, what do you want to do? Well, he wanted to take a trip. He wanted to do a couple of other things to bring life to closure. And so that was a whole shift in focus. And he really taught me about healing, so that as a doc, it's not just about curing. So even though we can't do anything to, we can do a lot for an individual. So, that's real memory.